Hello and welcome to the next instalment of the eGPlearning Podblast. I'm Dr. Andy Foster. I'm here with...
I'm Dr. Hussain Gandhi, and we're here together for the eGPlearning Podblast with Andy and Gandhi. What are we covering today, Andy?
So today we have another special focused Podblast, and we're looking at the up-and-coming NHS App. So this was something promised to us by Jeremy Hunt way back in, sometime last year. But it's quite sort of pertinent to talk about it today because it's out for beta testing. I think we're recording this on the 27th of September.
Yeah.
I think it's just gone out to private beta testing. The rest of us will be able to experiment with the NHS App from December this year. So actually it's almost upon us.
Yeah. So the reason we wanted to cover this is because obviously this is a potential massive change for the way that people access healthcare. And we're going to talk a little bit more about that in a second. But first of all, as always, we'd love to give a shout out to our sponsors. So hello, HTN.
Hello, HTN. So HTN, the health technology newspaper, an innovative daily news and opinion website for the health tech network.
And as always, guys, we use these people for getting our health tech information. They're great at collating all the various different things around. Highly recommend having a look at their website and signing up for their HTN 100, their little bites about 100 words of all the various different things out there to try and manage health tech and get involved and stuff. The other thing I think we want to say, as always, is a shout out to our lovely followers. We've got, a growing army of fans, I guess, effectively. So hi to JC Melody, Sonali Kinra, Knots LMC and NNC GPA. You guys always love tweeting our stuff and saying hi to us, as well as I'm sorry, I can never say his name properly.
Thacker,
Thambiraya?
Yes, I think that's that. Yes, I think you've got it. Yeah, well, once upon a time, I think he was practicing in Nottingham, but then ran off somewhere else. But I think we met the first five group a few times, the three of us.
Yeah, and also to Nick Harvey, the creator of the Digitalis app, who, after our little call out from our last episode, is interested in being interviewed by us. So we will definitely get that sorted with you soon, Nick.
Fantastic. Hope you're listening today, Nick.
So, what have you been up to, Andy?
So I've been, I've been nursing a cold and I've been on a cruise. I've not really done anything much more exciting than that, Gandhi. I'm sure you've been up to lots, though.
Actually, not too much. Things ticking over as always. Been pretty much just on holiday. Not really a holiday, but just at home sorting out things with the kids and that kind of stuff. Tip Thursday is going from strength to strength, and I highly recommend you guys have a look and a listen. After our last episode about the Alivekor system, actually we've got it up and running in practice now. So I've done another little one for Tip Thursday for that just last week. So worth having a look at.
Fantastic. Picks up any undiagnosed AF?
We have, in fact. We've had a couple for our flu clinics. So, great way of using it. Simply just get your over 65s and your flu clinics to have a go. And actually, to make things easier, I created a System 1 protocol that triggers every time the nurses do it, that leads them through what they need to do. That is on offer to all of our listeners if you just go to the eGPlearning website and have a look at the Tip Thursday episode on the Kardia Alivekor.
Fantastic, great work.
Yeah, feel free to borrow it if you want, Andy.
Good, I think I will. So let's dig into the NHS app. So just a shout out to Gizmodo.
Yeah.
Very, very good health. Not a health. They're just a general technology website. But they did a great article on the NHS Health app, which we've had a good look at and has formed the basis of some of the talking points in this episode. So shout out to Gizmodo.
Thanks, guys.
Good. So, what is the NHS app? So, promised by Jeremy Hunt, and I think the general idea it's there to make it easier for patients to access healthcare services, access their own records, and potentially book appointments with their GP and potentially in the future other health professionals. When Jeremy Hunt announced this app, he set out 8 challenges to the developers, or there were sort of 8 key features that they wanted to cover, and these were a symptom checking and triage feature, 1, 2, access to your medical records, quite ambitious, 3, GP appointment booking, 4, repeat prescription ordering, 5, changing data sharing preferences.
Okay.
So, interesting. Probably want to encourage us to share data. It's good, often good. Where am I? 6, I think. Changing organ donation preferences. Very important. It's worthy to have that there.
Yeah.
7, changing end-of-life care choices. Interesting. and 8 promoting approved apps, so linking into to other approved apps that may be useful to patients. So interesting, potentially ambitious. What do you think about those challenges, Gandhi?
So the great challenges, I think, to look at, because if you look at across the board, there isn't something that does all of this in one go. And I think that's one of the reasons why potentially Jeremy Hunt set out these challenges, to have your one central hub that does everything. We're going to go into them in a little bit more detail, so I think I'll reserve a lot of my comments for that. But the key thing is it's a massive challenge, and I think they've recognised this as well. So the original beta testing for this was meant to happen sometime in July. We're now tail end of September. They're already a couple of months behind, and I think for good reason. To try and do anything tech-wise in the NHS is always a challenge.
It's not bad. Not bad.
It's
I would
not
say
bad.
actually.
Yeah, you're right.
Hats off to them. Just a few months behind for something that's fairly ambitious.
I mean, if you look at the history of the NHS and IT, it is horrific. It genuinely is. So the fact they're only a couple of months behind is actually a testament to the effort that's probably being put into this. But at the same time, yeah, tech and IT and the NHS don't seem to go so well at times.
Yeah, what I would say as well is I think they've been quite sensible in terms of the scope, as I think you alluded to, Gandhi. All of these things are actually pretty much available in one form or another, either elsewhere or within the NHS. You know, patients can have limited access to their health records through web portal, via authorization from their GP. Symptom checking and triage does exist. You can book online GP appointments. You can order your prescriptions online. So some of those big things, they already happen, but like you said, they don't happen in one place. No. So and I think there is real value in uniting things in one place.
Definitely. So, I mean, if we talk about each of these things in turn, so the first challenge that Jeremy Hunt put out there was about this whole aspect of a symptom checking and triage portal or system or whatever that's contained within the app. Now, we've covered similar things like this already, haven't we, Andy? I mean, if we go back to our episode about AI, I mean, this is a key area where this is growing and has grown since this challenge went out.
Yeah, absolutely. I'd be very interested to see what they do with this, actually. I've seen some screenshots from the app, and a lot of the content seems to be reproduced from NHS Choices. And I know there's a sort of fairly aging, sort of old symptom checker on there. And I wonder if the developers may just borrow that content from there. It would be really nice to see them doing something a little bit smarter, like Babylon do, or some of the other competitors. I wonder if that's what it'll look like. But I think, in principle, it's a great opportunity. If this is going to become the place where a proportion of people book their GP appointment, walking them through some triage before that and signposting to potential alternative services or self-care, I think it's a big opportunity to potentially thin out the inappropriate demand going to GP appointments.
Yeah, I think it'd be great that, as usual, it's not one of these systems where everything ends up with and have a chat with your GP at the end of it. Yeah,
that's the other side of the equation, isn't it? Because a lot of the time, the way these systems manage the risk is they actually just transfer that risk to the GPs. But you get, but they have so much more traffic through. So actually, the net amount of work to the GP can, there's a danger that goes up as a result of implementing these systems. So I suppose it's all about how well they do it, I guess.
Effectively, I mean, Babylon claimed that their AI system is as good as a GP in terms of evaluating the clinical aspects that a patient presents with them, and I'm sure that as time goes on, that will improve in terms of the way it does it. We've also seen the negative way that it can work. I mean, feel free to, Google, Twitter, Babylon, UTI, and I'm sure you'll see the videos that show it. But at the same time, their tech is really good, and it does offer opportunity, like you say, to integrate a potentially positive thing with the way that patients access their healthcare systems and things. The key thing I would want to see is how that information is actually recorded. I don't necessarily mean within the app. I mean, will that then go into their medical records? Will you be able to see how many times a patient has accessed that as part of their medical records from the other side? Because actually, if you have a patient that's accessing it, for example, 4 times a week, that's health anxiety, that's hypochondria potentially being developed by a system that's designed to actually try and stop it from happening. Now, you could argue it's a good thing and a bad thing because it's stopping it from progressing. But is that then feeding into this whole concept of constant access? And it's just something that needs to be, I think,
it's true. On. And I suppose the data will be there. I mean, the system will know how often people are accessing. So if they get the right algorithm in place, they could spot the hypochondriacs and offer them some advice, or just flag that might be a risk for them. Are you accessing it too much? Interesting. You talked about the integration, and my understanding is that at launch this will be like many of the other systems that we've seen demonstrations for, in terms of actually the way it integrates back into your GP health record, is that it generates a PDF or email that goes to your GP practice and then is entered manually into your GP records, which I don't think is ideal, and I'm sure they intend to change that further down the line. Again,
it speaks to that whole aspect of the unobserved workload issue, isn't it? So, if that's the case, if every practice gets a PDF file every time a patient accesses the symptom checker through the app, I mean, potentially the amount of workload that comes through from that is going to be astronomical. If it doesn't directly integrate into it, then there's more workload. But then there's also that aspect of who's responsible for checking that data. Who's got the actual responsibility for what happens to the patient because they've followed that data.
Yeah, and have GPs been engaged with in terms of, it's coming in December. Yeah. We haven't had any engagement, about getting any of this data.
You and I are generally very tech happy GPs, kind of almost on the pulse. I'm sure we're not as good as some people in NHS Digital or that kind of stuff, but we don't know anything about this as such. So
that being said, I don't know that it'll send information through for the symptom checker, or we don't know. It may not.
We don't. We're speculating here.
Where the PDFs were mentioned were around the end of life decisions and things like that. Which I think, if people are indicating those kind of preferences on the app, then I think they're going to expect that that's going to be put back in the medical record. So for that sort of thing, it looks like the initial implementation is PDFs. It all depends on how they do this symptom checker there. I think big opportunity to make a positive impact. Potential opportunity for unintended negative consequences on workload and demand. It's all about the implementation.
Definitely. And we've been talking about medical records. I mean, the second part of what this app is meant to do is give you access to your medical records, which is both a massive positive. Couple of issues as always, Any thoughts on that, Andy?
Yeah, so what I am presuming this will do is this will link into the electronic medical records access that is offered by most, probably all GP practices now using modern clinical systems. Currently, the access is to read-coded records without free text, but in the future, people will be able to access free text as well. So I'm suspecting that they're going to sort of plug into the APIs. Can I think what's an API?
So I've forgotten the exact term now.
Application protocol interface or
I think
something. It's a kind of standardized way that software can retrieve information from another piece of software on behalf of you. So it's retrieval of that information in the background. You could go to your GP website and retrieve the information manually, but with an API, another piece of software you're using could, with correct authorization, interface with the holder of the GP records and pull that information.
So the way I would describe this, imagine you're going to a club, okay? You're going for a night out to a club, and most people that use it will go through the main door, main entrance, that kind of stuff. However, the performers, the people that are actually providing the service and that kind of stuff may want to access part of it, so they go through the back door that's verified, and they've still got a bouncer on there to let them in and out and that kind of stuff, but they've got a separate access, separate entrance to the back end kind of thing.
That's good, yeah. Oh, I like analogies. Or maybe it's like you go to the club and most people are going to the bar to get their drink, but you want to use a waiter, so the waiter kind of sits in between you and the bar, and the waiter takes your order, relays it to the bar, and then the stuff you want comes back. So kind of like that. Okay. Yeah. So that's how I presume it's going to work. So the bare bones of the implementation exist already, I suppose. Easy access to your medical records, potentially free text on your phone. What do you think, Andy?
So, as many of our listeners probably know, I work in a very deprived inner city area of Nottingham, and I think whilst it has huge benefits for particularly huge cohorts of our patients, so patients want to share what's happening with their healthcare with their relatives who may be looking after them, or the generally the working well that want to understand what's going on, access their healthcare records quickly about their results and that kind of stuff. I think that works really well. My concern is the more vulnerable patients. It's the safeguarding issues. It's the third-party references. It's all that kind of stuff that gets forgotten because the people that generally create these kind of systems aren't as concerned about that because it doesn't affect them directly. So, what happens to the patient that's being abused who has gone to her GP and said a lot of things in confidence? That information is now readily accessible for potentially their abuser to access just by taking their phone off them, which they may already have control of anyway.
Absolutely, it's actually quite a common way of controlling someone within an unhealthy relationship.
Yeah.
Control of the phone. It happens and we see it. So it's a potentially
and
volatile
there's lots of
information
other
on that phone.
Safeguarding concerns that come up with this kind of access and stuff. And my main concern is that part is never really addressed when it comes to access to medical records. It definitely has its positives. I'm not denying that whatsoever. And I think having that information at hand for the majority of the population works and works effectively and can help to streamline healthcare. But as always, it's the unintended consequences that are never analysed and never looked at because people just think it doesn't affect us. It doesn't affect the policymakers, generally speaking, these kind of things. But these are key issues that need to be considered, that need to be thought about, and need to really have that deep dive. Because what happens when that happens? What happens when a breach happens? We've seen numerous times how electronic data can be leaked or hacked or whatever. What happens if your medical data, your most personal information available, gets hacked and gets put on a website and stuff? And you may argue, okay, it's encrypted, all that kind of stuff. Defence areas have been hacked, banks have been hacked. These are things people forget. Governments have been hacked.
It is the most sensitive information that exists, I suspect. Your health records, if you're putting in place a system where potentially with the right authorization, any phone can can access those records.
Imagine you're working at your
very
office.
Careful.
Another analogy I would give, even for those working well. Imagine you're working at your office. You've been accessing your results on your phone because you had your lunch break and you accidentally left your phone on the side. One of your work colleagues happens to walk past and sees that actually you've got a diagnosis of HIV you've not felt that you needed to tell your colleagues about because there's no reason they need to know. And actually it's a well-contained condition, well managed, actually it's no longer the death sentence it used to be. But that's still your information that is now readily available, access through a device that is completely unrestricted potentially, especially if you have no security on your phone.
So, we're being very negative. Are there any positives to this?
As I said, there are huge amounts of positives. Helping your elderly relatives that are struggling to understand how to take their medications because you can see that information because they've consented to share it with you. Being able to help other people around you, that kind of stuff. Or you as an individual being able to access information about your healthcare. So, for example, if you have a chronic condition, you want to know how to manage it. You want to see the track changes, for example, your diabetes care, your blood pressure, that kind of stuff. You can see that history, access it. You can get information potentially or direct from your consultants because actually a lot of people come to the GP for information from their secondary care consultants when actually it should be communicated directly to them. You shouldn't have to go through your GP to get information about what the consultant said to you. This allows that to happen a lot more effectively, a lot more
hopefully there'll be access to medical documentation from the hospital. That would be very useful.
Yeah, of course it would. How many times have I had a patient contact me for the results of their scan? Well, I've not requested the scan. I'm not going to know about it until a consultant tells me about it. And actually, it's not even my responsibility to.
I just thought of an interesting point, and this is about how easy it is to get information from your phone. Because a lot of this, I think, depends on the device and how that device is commonly used. Because if something's on a desktop, at least in the good old days of, now I still use passwords. And, the password's in my head. I have to be awake. I have to be cooperative in order for me to enter a password. But now you've got fingerprint scanners on the phone.
Face scanners.
Somebody just needs to, put your finger on the thing when you're asleep, or flash it in front of your face, and they can access your phone. And the level, you don't have to be cooperative. So it's just struck me, and that's something which I wonder, is an issue about how secure information is on these devices.
And again, just to be clear, I think in many ways it's a really positive thing. What I would love to see is a genuine consideration of the risks and the dangers, and I've yet to see that. That's my concern.
Now, one of the main arguments for doing this, I think, is to get people more involved with the care of their long-term conditions and with their healthcare, so they can access the notes, become more involved in what's going on. Do you think that will happen?
I'm going to take that time-old tradition of time will tell.
Time will tell, yeah.
Because I think for certain patients it will work really well. For certain patients that they won't want to know.
So people can pick and choose, I guess.
Yeah. So it will speak to some patients. It won't speak with others.
Yeah. The other thing, this is just this is a suggestion. Just come to me, because a lot of the things I worry about, and a lot of the problems with this is that patients will have access to historical records, and the quality of record keeping historically is not necessarily that good, because people were recorded because they thought that only doctors and healthcare professionals were going to read it. So a lot of it is quite
doctor-centric,
coded, I guess, in a way. It can be difficult to understand. A lot of it's quite nuanced, lots of medical jargon and language and things like that. I'm just wondering how useful that would be. Also, there's potentially damaging things recorded there, should be redacted, but that's a huge process. This is a suggestion. If you're listening, maybe we could start, year zero right now, and have the shared medical record, and maybe historically, that's your historical medical record.
And I think that's the reality of how it would have to be. So to explain Andy's points a little bit more detail, I've seen multiple records where patients may have had blood test results that initially, if you look at them as a layperson, you may think, oh my god, these are the worst things in the world. There's so many red bits. Why there's so many red bits? I'm really worried about this. But actually, from a medical context for that individual patient, actually that's fine for them, and it's not a medical concern. But then that doesn't obfuscate the worry that patient may have about it, and then that leads to another contact because they're worried about it. It creates more work, it creates more anxiety. There is the risk of those kind of aspects happening. And like I said, I take it back, third-party references. A lot of the times these medical records were originally designed to be held by medical professionals, not to actually be shared with patients. That's obviously changed in the past few years because we recognise that's a good way to do things. But if you go back 5-10 years, that's not how medical records were designed to work in the first place. So, there is this option of starting from year dot, let's move forward from that point. At least it's more sensible and it's more appropriate. And
everybody knows what the purpose is. It's about getting patients involved with their care, record data for that purpose. So I'd potentially be an advocate of that.
And the third challenge that Jeremy Hunt put on there was about GP appointment booking. So this is a key issue. Obviously, access is the big buzzword in primary care. Always has been, pretty much always will be until there's unlimited access, which there will probably never be because we don't get that much funding. But actually a lot of apps do this already. So the two biggest players for medical records access in the UK is EMIS and System 1. And they both have methods whereby you can book online through either your practice website or through their own individual apps. The reality is a lot of people don't use it.
I'm going to ask you a question, Gandhi. So do you have nurse appointments available through online booking?
No, we don't, because we found that they were either not attended or not used.
Yeah, and I was going to say, do patients, because we have some nurse appointments, and my question is, do patients always book the right appointment for their problem?
Well, I don't know. For our practice, I couldn't say because we don't offer nurse appointments, because we found that when we did, it just was completely pointless. I think you would need a system that lets them know these are the things that you can see this person for. Because I think often certain patients will clearly know that I need to see person X for this and person Y for this. That's what I should be doing. I would argue majority of the population still don't understand the difference between a GP, a nurse practitioner, an advanced nurse practitioner, a physician's associate, a pharmacist. There are sometimes even GPs don't know that.
And it can be different from practice to practice as well. I'm just sort of alluding to a potential concern I have that it would be great to open up loads of appointments for booking direct from an app, but the useful thing about booking through your practice is that receptionists can help the patient navigate to the right appointment for them. It may be that actually at that surgery that's best seen by a particular doctor or a nurse practitioner, and you lose that.
I think we have to move away from this whole general consensus view that I need to see a GP for everything. That's the reason why primary care is on its knees. Everybody still has this view, I need to see a GP for everything. To have my blood pressure checked, I need to see a GP. No, you don't. You do not need to see a GP just to have your blood pressure checked. Please do not go see your GP just to have your blood pressure checked. It's things like that. So, sorry, I will stop exemplifying. I can't say it now.
Do you feel you're being too negative?
Yeah, probably. I apologise if I am, guys. I'm sorry. It's just I blame it on the caffeine depletion.
No, it's often sometimes the problems are easier to see, aren't they? But there's the obvious benefit is the convenience for the patient, isn't it? That's where this is coming from. And actually, you start to one of the potential benefits here is that you're packaging a lot of these functions together. So, direct GP appointment booking on its own, that might be negative, but actually they're talking about putting a layer of symptom checking and triage in to filter out unwarranted demand. So.
And I'd argue that's the reason why the current systems don't work. So the System 1 app that I use when I access my GP only allows me to do one of two things. It only allows me to book an appointment, and the appointments on there are fairly limited, or it allows me to request repeat medications if I had any. That's all it allows me to do. Now, me, personally, I don't really have a need for repeat medication. I don't take anything on a regular basis. So booking appointments, it is actually a lot quicker for me to call, and then I'll get to see the person I know I need to see, or I think I need to see based on what they're offering, and I will always listen to what they say in that respect. But that works better. Having something that does everything all in one go, and also I think to a degree can also signpost you to what you may need to consider as well. So having those little reminders on the side saying, oh, but you also need to do this as well, and you need to consider this, and the little nudging as well, healthcare promotion, that kind of stuff. That'd be great if they had that with it. Because that's improving the general health of the population. I
think it'd be good. Well, notifications would be great if it could prompt you to, and we might get to this, but it's time to take your medicine. Remember to eat a healthy dinner tonight. The level of personalised notifications could be potentially good. It'd be interesting to see if people pay heed to them. I think that would be useful. With GP appointments, I was also thinking about this whole kind of streaming idea as well, which comes in with the triage. So it might be that actually some patients, after going through symptom checking, it might actually call your GP or have a conversation with the practice about being seen. But then there might be a whole stream of other people who, which is just sort of urgent, acute, same day things, who they can say, actually go and see a GP in a central hub that's provided for all of your GP practices, because you don't need to see a particular type of a particular GP. The continuity is not too important for you, so we can stream you somewhere else, which will get you seen quicker, and then the kind of appointments at your practice, they can be reserved for people who actually need the continuity. So there's some potential benefits to that. Next one is repeat prescription ordering. I would say, okay, great, I guess is what Definitely. I would say to that.
Yeah, I mean, this is probably one area that's a lot more sophisticated, I think, than the others, because there's a lot of private companies and other companies already offering this service, as well as the individual computer system creators like System 1 and EMIS already. So I think this area works already quite well, but clearly having this integrated into one portal is a real power. I mean, the other side of it is if you were to integrate that with the appointment booking system, so it recognises that actually your review of medications is due in the next couple of weeks or so. Would you like to book an appointment with a practice pharmacist to have a review of your medications? Or, you are actually due some blood tests because of the reminder that the practice has already put in their medical records saying that as part of your medication review, you need to get that sorted. Here's the notification to remind you about it.
I wonder if they can push out notifications, say...
well, that would be the...
Contact the surgery for your flu jab.
Exactly.
For your review.
Health promotion.
If we could push things out, that'd be good too.
It would. And I think, actually, our developers out there, if you're listening to us, if you haven't integrated that into this app... Please, what are you playing at?
Please do, that'd be great. So much better than the NHS paying all of these text message fees for the text messages. So some of these, the next few, sound like no-brainers really. Changing data sharing preferences, maybe not. What do you?
So sharing data in the NHS is a interesting aspect to have a look at, because this is probably one of the areas where the NHS has had real historic problems. So we've had things like care data, we've had things like the summary care records, we've had the detailed care records, we've had lots of different sharing aspects of data that have come across our way. GDPR has made it even more complicated or intricated, or however word you want to use.
Go back and listen to our episode on that and see how confused we were by GDPR. I think things have become clearer since the implementation.
Definitely.
But yes, that was confusing at the time.
But the NHS's record when it comes to sharing data is not the greatest, because there's so many layers of sharing your data. And even as clinicians that are meant to understand this, half the time I don't even understand it, because there's so many different layers and things. I think being able to share your data preferences is useful, as long as it comes with a clear and apparent way of explaining what you're actually signing up to. This can't be the Apple tiny little script, agree with about 2 pages of data information before it saying, do you agree to this? It has to be clear, it has to be sensible, and it has to be in terms that people understand. If it is, great, because then you understand what you're signing up to. If it isn't, I'd argue this is potentially a way of selling data yet again that we are always concerned about when it comes to health applications.
Yeah, here. I can only agree with the points you've made. Yeah, it must be clear what you're signing up for. I think it'd be helpful to be able to have a few categories of data sharing, but not too many categories as to make it confusing, and to choose who you're sharing with and so forth. Yeah. Organ donation preferences. Is this going to be the answer to increasing the number of people on the organ donation register? Do we think?
I think it'd be interesting. So it'd be good to bring it into one portal, because at the moment, if you wanted to change your organ donation preferences, you have to go to a completely separate part of the NHS website, log in, register, do that, all that kind of stuff, and then you get yes or no based on your preference. And the interesting thing I thought was, so the Gizmodo article that we've used to look at a lot of the structure of the app and stuff mentioned one concern about how much of NLP aspects could you use to direct people how they want to do it. So, for example, if the 2 buttons, the yes and no, and the yes one happen to be a lot bigger, more bolder font, that kind of stuff, is that going to psychologically make you think about donating more? Which may be a good thing, but there are clearly some people who feel that that's not what they want to do. Now, obviously, organ donation is a challenge in this country. The more we have means better potential health options for those in a need. Same with blood donations. We are always short of blood products in this country, and donating blood is a really good thing to do, and can help out other people. But how much influence will the app have in terms of doing that? Is it going to be a clear and simple method, or is it going to be a motive behind it, shall we say?
Interesting, yeah. And it just made me think about A/B testing. This thing where 2 different people looking at the same website or app can see 2 different things, and developers use it to see which approach gets the desired outcome more often. So I wonder, maybe they might do some A/B testing on the organ donation screen with an objective to increase uptake, or in some of the other areas. But that you were talking about varying sizes of buttons, just made me think about A/B testing. They could use that in all sorts of areas of the app, actually, to learn about what works and help the app evolve and develop.
So number 7 is changing end-of-life care choices. What do you think about this, Andy?
Yeah, very interesting question, that, Gandhi. It's often these sorts of conversations around end-of-life can be quite challenging. They can be quite complicated. So it'd be interesting to see how they implement that, because it's something that can be quite difficult, and we take a lot of care when having these discussions, and just to have these questions out there on an app for patients to indicate their preferences. It would be interesting, because have they really understood what they've said in terms of do they really understand the implications? Really, are they really the people who's expressed the preferences? It's interesting. So I'm not, but then again, often it can be difficult to get that information. Often we're guilty of not having the conversations in time to get those preferences from people before they can no longer express them, or before a medical emergency develops. So there's 2 sides to it, I guess. But I'm a little bit concerned. What do you think, Andy?
I think it's an interesting area. So one of the things I always try and remind people and patients is that decisions about end-of-life care are decisions that are made with patients, but effectively are often a medical decision. So that's one thing. The decision to withdraw care or to keep going, or so the DNAR, do not attempt resuscitation. It is actually a medical decision that's made. So that's one. I guess the other thing to consider is how is this information actually shared, in the sense of if you were to decide that you didn't want resuscitation in a certain instance, and you just clicked a button that's somewhere then hidden in your medical records, that's not really been notified to someone, may not become clearly apparent because the integration isn't there, for example, then what happens in the event of if something happened and you were to be attempted to resuscitate? So we have lots of cases in America where people have been resuscitated against their express choice, and therefore as a result there's been legal cases about it. There's those kind of things. How do you, it's not like it's something that's easily accessible, because the whole point that we just discussed earlier is that I can't get into your app to look at it to see that information.
Unless you just hold it up to their face when they're lying
as you're
on the floor.
As you're unconscious, having a heart attack, holding out your phone saying "Do not resuscitate."
Look at their whole medical record.
Exactly. So there's that aspect of things, and I think it's something that is a useful thing in clear situations such as end of life care itself. So palliative situations, I think it can have some understanding. The other part is, does that information then going to be shared with your relatives to let them know that you've made this decision? To let them know, one of the challenges I genuinely have looking after patients is when the patient has told me that, they're come to the end of their time in terms of the course of their disease, and it's clearly the last few days they've made this decision, they don't want to be resuscitated. This is how they want their life to finish, effectively, and it's a really powerful moment of their healthcare. But sometimes the relatives don't want that. The family around them can't accept it, or that's not what they want. With all due respect, it's the patient's impact that worries me more than anything. But then that leads to angst, it leads to frustration, it leads to all these other kind of challenges that come with it. And then complaints come out of that, and that's not doing anybody any good in the end. So that's the worry and stuff. And I think that's something that needs to be considered in opening.
So how would you implement it if you were in charge of the implementation of this? Would you, and if so, how would you? I
think I would reserve it for situations where end of life care. So if we were starting out, I would reserve it only for end-of-life care situations, for those palliative care patients, first of all, because it needs to be trialled. I don't think this is something you can open up to the entire public straight away. The second part is I would also actually include an option of, I want to share this information with certain people that the patient chooses, so at least they get notified of this as well. So it is a lot clearer. The aspect of how you notify someone if you suddenly end up in an A&E department, I'll be honest, that's a little bit trickier. There is the summary care record that should have that. And it's making sure the back end of this, that this notification is put as a high priority. It's in the medical records as a, from our perspective, as a problem that comes up, so that when I look at your medical records, the first thing I see is this, so it needs that follow through. Again, consideration of what's going on.
I think I'd be clear, perhaps, that this is about be very clear that it's about expressing preferences, and use it as a way almost to start the conversation. So, okay, you need to think about this. Maybe you want to express a preference which can be entered here and then distributed to X, Y, and Z, and give people those options, and then maybe actually say, to complete an actual DNA CPR form, this may be when we actually go and see you, go and actually see your GP, and perhaps do it that way. Number 8.
So number 8 is about having the option of promoting approved apps to patients. I think this is probably the most positive area I'm going to be involved in. So having approved apps for patients to use is great. I think we've talked a lot about the kind of apps that you and I both like using and that we've come across, and positives, negatives, and all that kind of stuff. There's always going to be some, but having a ratified library. So there is actually one. There's the NHS App library. About 70 apps on there at the moment.
I'd be surprised if the NHS App library doesn't look very much like that myself. I think they'll borrow the information. But yeah, it exists.
But there are other organisations. So there's another organisation called Orca. Now, please don't ask me to remember what it stands for. I honestly can't. But Orca is a group that does kind of what the NHS App Library does as well. They validate and authenticate apps.
I think I heard they were partnering up. This is just bubbling from my brain. Yeah.
You're right, Andy. So about a month ago, they decided to partner up with this app to provide validated information for it. And that'd be great. So say, for example, you are struggling with mental health issues and you want to access support, but actually you don't want to speak to someone face to face because that thought actually really plays into your paranoia and how you're feeling. But you just need that little bit of guidance, a little bit of help of what to do. Accessing, for example, one of the apps we've discussed in the past, Headspace, Calm, that kind of stuff for support, and understanding and knowing that they are validated information approved by the NHS, because that's the key thing. Everyone always comes in and says, "Oh, I'm sorry, I Googled it." Well, I don't mind necessarily when people Google things. It's just making sure that they've got information from a validated source, from a sensible place, not just someone down the back end of the pub telling them what it is, kind of thing. So having that validated resource, I think, is a great and amazing thing. And if you were to integrate that with some elements of the signposting, symptom checker kind of thing, saying actually you've got this, and this,
one of your options
is this,
is to try this app.
Or even if you've got chronic disease, you've got chronic disease, there are apps out there to help patients with asthma, with diabetes management, that kind of stuff. Have you considered using this to help support your management? I think it's a great aspect of the potential NHS app, and clearly should be in there.
Yeah, and I would just say here. I think it's an excellent addition. One of the things I think is one of the future aspirations of the NHS app is to almost position it as a potential platform for other apps as well. Not quite sure exactly how they're intending to make this work, because I know that both iOS and Android also have elements of the operating system to position them as a platform for holding and sharing health data. But I think this is an area that has potential, I think, so that an ECG app might be able to read-write into the NHS app database and into your health record via the NHS app, or something plotting your mood scores or weight or other metrics. I think.
Yeah, I definitely agree with you, Andy. I think, one cool thing would be a lot of people now have health bands, Fitbits, Apple Watches, that kind of stuff that capture, certain data and stuff, and being able to import that directly into your medical records may be of real value. Again, the question of how is that data managed and all that kind of stuff, again, needs to be asked and answered before it goes ahead. But definitely a point in the future that I think would have real useful value to patients and to healthcare.
Yeah, absolutely. So, we've covered each of the main 8 challenges set out by Jeremy Hunt, which hopefully the app will deliver. So I guess as we're rounding up, is there any other observations or thoughts that we've had about the app, just as we run towards close?
Well, I think there's Jeremy Hunt actually did some really cool work here. He set out a plan for creating something that may have real value, I think, to the general populace of the UK and stuff. I think it's important to recognise the limitations of what it can potentially do, but also accept that the value that it can bring. I think if I was looking for other kind of features, what about consultations being run through the app potentially?
Yeah.
We're now in this era of telemedicine coming through, and is there a way that it can be used in that respect to actually support direct access in that respect?
I think that's in the roadmap, as in that's what's coming next for the NHS app.
Possibly. And it'll be interesting to see how that plays with all the current manoeuvring that's now happening in terms of primary care access. So we've seen obviously things like Babel and GP at Hand. We've seen things like Now and some of the super partnerships. We've seen things like what was the other one? I think there's another group in Birmingham that's just aligned itself with a push doctor company or something like that. So various companies that are aligning themselves with healthcare providers in order to have this overview system. It'd be interesting to see how the NHS app plays with that, because it's obviously another tech system to integrate to. And again, I go back to my earlier point of NHS IT is really bad at integrating.
Are we at another point where we're about to... So with clinical systems, we had fragmentation. It was never whole, really, so it didn't fragment, but we have a fragmented market in terms of clinical systems, and we had years and years of problems with those systems talking to one another and transferring data from one another. Are we on the threshold of another fragmentation of technology, and we're going to end up with a fragmented health app technology with a few key players, perhaps one of which is the NHS app, and we're going to go through another decade of them
I hope not
not
I can't
talking to one another.
It's just painful.
It's a potential risk, although hats off that I guess the NHS app is perhaps trying to position itself as an NHS owned solution that may be able to do all of these things. And it sounds like they're planning to position the app as they're talking about having APIs so that it can play nicely with other apps. So it'd be really nice if this time we start with the open application protocol interfaces, and that patients can choose to use the plain vanilla NHS app, or if they have a choice, they can use something that's different or more bespoke to their needs. Like maybe they prefer a Babylon product or another product. It'd be really nice if they get that right from the outset this time, and hopefully they intend to.
I hope so. So, what do we think overall then, Andy?
So I think I haven't seen it, but I'm broadly positive about it. Actually, my main concern would be about losing, as a GP, losing control of the access to the appointments on the appointment books of the practice, because we do our very best to make sure that those go to the patients who need the appointments, not who can use the app the best and answer the questions on the app the best. So that's probably my main concern, actually, as well as information governance and privacy. That goes without saying. But in terms of how it's going to impact me day to day, those are my main concerns. But I'm broadly positive about it, and I'm optimistic that if they get the triage right, they might even need to partner with a private provider, to power that part of it. And I wouldn't potentially object to that. And that might be a different partner in different parts of the country. I don't know. So there's competition. But if they can get that right and filter out some of the unnecessary, the worried well type demand, to help leave us with those patients who really need appointments, and then we can kind of make decisions or help those patients get the appointments, I think that would be good. So I'm broadly positive. Yourself, Gandhi?
I think I'm positive about the concept. I'm slightly sceptical about the execution, because unfortunately as I said multiple times already, NHS and IT are never great players when it comes together. There has definitely been some change, and a lot of that has actually come from outside of the NHS itself. So Babylon have in their tech methods created some really cool things, but obviously it's about the execution at the end of the day. An interesting one that we didn't really talk about in great detail, but one thing I did want to mention was the other part is how you verify yourself with the app. So one of the potential things is you may need to use some things like photo ID. I'm mindful of the fact that I have several patients that do not have any photo ID. In fact, this is a recurrent issue that we have in terms of them being asked to provide photo ID, but they've never travelled outside the country, never had a driver's license, so they don't have it. So then that limits their access.
Yeah, so there's some wireframes that we've seen of kind of how the app works, and the verification section has an element of submitting a photo ID and a photo at the time when you're accessing the app, and those being matched. And maybe some people don't have photo ID, so there have to be some other backup mechanisms.
And I guess the other aspect is also about language ability, use and that kind of stuff. So if you are non-English speaking, how does that work with this? Will it be in the multiple languages?
I hope so.
Yeah, I can understand for some of our listeners that's a minor consideration, but actually it's something that does need to be, again, considered. And I guess that's one of the key things I want to hope and see. So, one of the things both me and Andy were talking about, that if the beta testers, if the creators of this kind of thing are interested in having our perspective, we are more than willing to offer it to you. If you're happy to let us have a look at it, we will happily look at your app and
absolutely, that would be very, very interesting. We really welcome the opportunity to comment on it.
Definitely. So we hope you've enjoyed this episode on the NHS app. It's been a bit of a deep dive, and we've had some really good feedback from when we've done these kind of episodes. Next time we're looking at something not completely different, but along this vein. So we thought we'd cover telemedicine itself. We've talked about it a few times in some of our previous episodes, and both Andy and I have a little bit of experience with how this may work in primary care and stuff. So we thought this would be a good time to cover it for you guys, and hopefully you'll get to enjoy an interesting episode and another deep dive, and definitely one to listen to.
I wonder if we should do that with a webcam.
Well, this is the other thing we've been talking about, guys. We are planning on putting some video footage of us doing these podcasts out there for you. So if this is something you would like to see, let us know, guys. Feedback in the comments and stuff. As usual, we love to hear your feedback. We'd love to hear what you think about the work that we're putting out there for you, and also any criticism. Actually, we will happily take on criticism.
Constructive criticism.
Constructive, yeah.
Something we can use to improve.
Yeah.
But yeah, bring it on.
Definitely. But yeah, so we're thinking next time we're going to video this, and for our followers, put it out there as a
unedited video, behind the scenes sort of tour of an episode, which might be interesting.
Definitely. But we hope you find it useful, and like I said, guys, let us know what you think. As always, you can find us on our various platforms. So we're on iTunes, YouTube, Podbean, and Spotify. And you can find us at eGPlearning.co.uk/rambling/podcast, and also on Andy's website.
Yeah, avoidingpuddles.com, and at Dr. A.W. Foster on Twitter.
And at Dr. Gandalf52 on Twitter for me, or Facebook as Dr. Gandalf, or eGPlearning. So we hope you've enjoyed the episode, guys. Do get in contact with us. Again, a shout out to our sponsor, HTN. Do have a look at their website, see what you think, guys. And always keep listening.
And keep listening. So it's goodbye from me.
And goodbye from me. See you later, guys. Bye.